PQA was created back in 2006. It was created alongside the Centers for Medicare and Medicaid Services, their Medicare Part D prescription drug program. When PQA was formed, the idea was we were building a value-based construct, and we were really evaluating the quality of medication use and focusing on patients and improving their lives.
It was very clear from day one of Medicare Modernization Act implementation that we needed a much stronger partnership with pharmacy experts around how to integrate drugs effectively into the modernized care that we were aiming to provide under the MMA.
Way back when, in the beginning of Part D, nobody was talking about a value-based healthcare system. We were able to launch this vision, which became the PQA, which has become an enduring concept over the years because it's frankly focused on where we need to go as opposed to where we've been. One of the people that I thought of immediately when we were contemplating the launch of PQA was Laura Cranston. I knew what Laura was going to deliver in terms of being able to focus a large group of people, keep them laser focused on a mission, and deliver results.
What impressed me most about the various stakeholders that came together at PQA, when they came to PQA, they were committed to that vision and the mission and came to the forefront of PQA for the sole purpose of how can we stand up a set of quality measures initially for this Medicare Part D program. When I think about days after that first press conference at the Hubert Humphrey building, all I can say is the board always believed and really never wavered in their commitment. Other alliances have come and gone, but I think our commitment from our board of directors carried us through.
The greatest accomplishment that PQA has had is remaining a constant in a changing healthcare system. The mission has stayed very clear, and the stakeholders have stayed true to the mission.
I think PQA remains relevant today because the core challenge that brought it together, the potential for helping people live better and healthier lives from using medications effectively, the potential for finding innovative and less costly ways to make the most of what pharmaceuticals and pharmacy services can do for people, that challenge still exists. We've made a lot of progress, but there is so much more that's possible in the future.
PQA's endurance and relevance within the industry is really driven by the challenges around medication use. There are so many huge innovations that have come in the past 20 years, but that also brings challenges. You have to work within the construct of healthcare, and so I think our endurance and relevance has always been focused on the future and meeting those challenges where they are.
PQA is just beginning. There's been a solid foundation built for the successes for PQA to have for the future. This comes at a time when the healthcare system is now beginning to pivot to include more participants, more providers in the value-based payment environment. That wouldn't be possible for pharmacists unless they had measures to measure quality and measure value. I'm delighted to see Micah follow Laura because he has not missed a beat in terms of creating a good sustainable path for PQA into the future.
There's opportunity for this organization and tremendous growth potential. The organization itself has been so strong for 20 years. I'm so proud to be a part of the 20th. It's unrivaled within the healthcare system.